I am here with Dr. Karina Shulman, who is just Karina to me because we go back. Dr. Shulman is well, first of all, she's a longtime Arena Fitness family member, but in her real life, she is a practicing psychiatrist, working in private practice and with the community, primarily on the West Side and in the Valley, right?
That's correct.
Okay, cool. Now, and you've been a member of the Arena community for 7.5 years.
You know better than me.
How long does it feel? It doesn't feel like more than a day to me. It feels like it's just brand new. Like our relationship is fresh. But yes, I actually checked, and you have been with us for over 7 years, and of course, your daughter has worked with us as well. So you're a deeply embedded part of the family, and I'm so grateful for you spending some time with us here today. First of all, just I kind of gave a real brief overview of who you are and what you do, but tell us a little bit about what you do and what your practice is and what your role is with your patients.
Yeah, so thank you for having me today with you guys. I really miss you all. So yeah, in my spare time, spare from Arena Fitness, I do psychiatry full time. Yeah, I am an adult psychiatrist, and I have a little small private practice, and I work for the community mental health. So busy full time. I do telepsychiatry right now, so luckily I have a lot of work to do.
And tell us a little bit about the patients that you normally work with.
Two different types of population: the severely mentally ill and less severely mentally ill. Patients who hold jobs, who have families, who are more functional. This is my private practice patients.
Gotcha. Okay, cool. So before I get into kind of asking you some questions about that, I'm curious, how are you doing with the stay-at-home orders? Are you finding yourself kind of challenged a little bit more with regard to your own mental health than you would normally be? And if so, how?
Frankly speaking, not really. In the beginning, it was a little strange, but I adjusted, as most people, I think. I guess the most challenging part is now I have to do more things that I did before, and such as cleaning my house, because the house cleaning lady is not coming still. So yeah, I do more things. I go to the store, grocery shopping, and I do all this cleaning, laundry and all that. But I mean, it is what it is. So no, I'm okay, and thanks to you guys that I think help all of us to keep our sanity.
So you're not struggling too much. I normally see you like 3 nights a week at the gym. And I know that must be breaking your heart that you're not able to come in and see everybody from the community, but it sounds like you're holding up pretty well.
No, luckily, yeah, I'm doing pretty well. Yeah, thank you.
Okay, good. So are you noticing a difference in your patients, the people that you normally work with? Are you noticing an increase in the seriousness of mental health issues that they are dealing with? Are you noticing an increase in the overall level of mental health issues right now?
It's interestingly enough, I don't see huge problems in my higher functional patients who are staying home right now for the most part, and some of them are working from home, but some of them are not sure if their jobs are still there when the quarantine is over. So these people are surprisingly not struggling that much, because they still have their paychecks coming, and financially they're not as worried, most of them. But interestingly enough, my other type of patients who are from community mental health, my schizophrenics and my severe bipolar patients, they are struggling way more, because they used to have those mom and pop jobs. They worked in construction, and this was something that they do daily, to get distracted from their mental issues, and they cannot do it now. So they feel stuck at their homes, and they're struggling a lot.
So is it kind of a situation where people who struggle with these higher level mental health illnesses like schizophrenia are able to manage the condition much more under normal circumstances because they have a routine that they can stick kind of out of their head and takes them out of focusing on the illness itself? And now with the removal of that routine and that structure, they're kind of left facing the seriousness of their...
Yeah. And usually they cannot, you know, contact their family members. I mean, besides the ones that they live with. So they feel pretty lonely and out of place.
Gotcha. And that actually raises an interesting question, which is, who are the people that are most at risk right now?
Yeah. So, you know, it's interesting that you asked this, because I think, yeah, I think all those categories that you mentioned, the ones who, my colleagues, nurses, the first responders, I mean, those are the ones who are under definitely a lot of stress because of the long hours, because of the fear of getting infected and infecting their family members, and actually dealing with sick patients. So they have a very high chance. So they are under lots of stress right now, no question about it. The other category are our elderly ones, you know, our, you know, grandparents, because they are very isolated right now. They are very lonely. And I see a lot of depression coming out. They become depressed. I have those patients too. And the other one that I want to mention are teenagers. I mean, these are the ones, and to me, teenagers are pretty much, you know, 13 until 30. This is the new group of teenagers.
I mean, I was definitely a teenager until I was 30, so.
Yeah, the reason I say teenagers, because this is the group of people where when the mental illness starts first. So the serious mental illness usually starts at this age.
Gotcha.
So any kind of stress, severe stress, can trigger it. So this is my opportunity, I think, to ask all of you to pay close attention to your loved ones, to your family members, no matter how old or how young they are. But these two groups of people, I think, deserve a little more attention. I think kids deserve attention all the time, no matter how, either COVID time or non-COVID time. Usually we are the ones who are not the first one to see them. You, the family, are the first ones. So please, please pay attention to them.
So that's a really good point. And that's something I was going to ask you later, which is, what should we be paying attention to? What signs should we be looking for with regard to serious mental health issues in the older population, or in our teenagers, or in the people that we love?
You know, what you're looking for are any major changes in personalities. If your daughter or your son, you know, were outgoing, social, funny before, you know, and all of a sudden they're spending more time with the door closed, go and ask questions, you know. Pay attention. Something is going on. It's not for no reason.
So it doesn't necessarily fit into a specific category as far as symptoms that you might notice. It would just be if you notice a significant deviation in their normal behavior, or...
Yeah, the symptoms come next, and the symptoms may not be something that you will be seeing right away, or unless it's too late already. Before the symptoms, there are just changes in behavior. So that's what I want to point out to you, that just pay attention to your family members. And it applies to elderly people too, as the same thing, you know. If they don't want to talk, to you, if they answer one word or two words instead of the whole sentence, you know, and these are all little signs that should trigger your question, like, what's going on with you? Let's talk, you know.
Karina, if you know, a family member notices a significant difference in behavior and talks to the loved one and doesn't get a significant response, and the changes in behavior persist, what then? Like, at what point do they reach out for professional help?
You know, I mean, the family usually knows when it's time to reach professional help, because lots of questions, lots of issues can be solved with the family members, lots of them. You know, I always say that not every depression is clinical depression, what we call major depression. Not every lack of focusing and concentration is attention deficit disorder. Not every mood swings are bipolar illness, okay? So, I mean, it's a huge diagnosis, right? It's a big difference between mental illness and just adjustment issues. So you will know when it's beyond the little sadness or little emotional state of mind. You know, you will know that. And then definitely this will be the sign to go and ask for professional help. And we can talk about actually professional help.
Yeah, where can people find some resources for that?
Yeah. First of all, I want to point out that lots of people, including my husband in the past, don't know the difference between psychiatrists and psychologists. Right?
Yes, excellent. Explain that.
So, and that's why they look for help in places that they shouldn't be looking for help. So the psychiatrists are the ones who went to medical school, right? So we do have MD next to our names, right? And we deal with we deal with all kinds of mental illness, but mostly with the ones that needs medication management, right? So it's more serious stuff. The therapy, like adjustment issues, adjustment disorder issues, some, little, family issues, issues with teenagers and stuff like that. This is
dealing with anxiety and
again,
okay.
to what degree, right? So
right.
not
okay.
anxiety need medication, but there are anxieties that unfortunately do need some pharmacological help, right? So when, and again, you can always start with a therapist, which is a psychologist, or family and marriage counseling, or even social workers, who are licensed clinical social workers can do therapy. So you can start with them if you're not sure. And they may refer you afterwards, if necessary, to see a psychiatrist. So we do not spend much time in therapy. We spend time in pharmacological treatment.
Okay, that's great, because I know that there's probably a lot of confusion about where each person's professional expertise lies, and everybody has a specific expertise. So
everything you see in those old movies, with the patients on the couch and the doctors talking to them, it doesn't exist. And so it's not what psychiatry is about now.
Circling back a little bit to talking about the essential workers, somebody on Facebook, a Facebook friend, posted an article that a prominent ER doctor in New York, who's kind of been on the front lines of the battles against coronavirus, committed suicide just a couple days ago. Is just to circle back a little bit, what sort of, is it safe to say that the people who are the essential workers, and the people especially who are the nurses and the doctors, the physicians who are hands-on in that kind of warlike environment, are experiencing extraordinarily higher levels of stress that might result in suicidal thoughts and things like that?
I think this is the perfect example of something that didn't happen overnight. So most likely this person, this doctor, some issues before. And this just the additional stress, just resulted in, unfortunately, such a tragedy. But that's what I'm talking about, that the mental illness doesn't happen overnight. It's usually cooking there for some time, right?
Yeah.
So unfortunately, doctors are no different from other human beings, and we all suffer from the same thing as everybody else. So my guess is that this doctor had underlying depression or something like that. Substance abuse issues also. People cope differently, and one of the very unhealthy coping skill that lots of us have is substance abuse. We drink, we do other things, so because we lots of us don't know how to handle stress, and if this is a chronic and severe stress, people want some relief, and pills and booze are one of the relief.
The quickest and easiest thing to grab for that offer immediate relief, right? Long-term pain, but immediate relief.
Exactly. I always say that I don't know a single person whose life problems have been solved with alcohol. I just don't.
Yeah. This may be a question that that falls under the category of psychology or therapy, but are there any things that you would recommend that people do under these sorts of circumstances to kind of just help manage and mitigate anxiety or stress, or just cope? Any sort of coping strategies?
Actually, one more thing that I wanted to mention when you asked about resources and help, that I forgot to say that, again, lots of people don't know that, but mental health treatment is there. It's not hidden. No matter if you have insurance, you don't have insurance. I mean, there are clinics that, community clinics, if you, for example, you work, but you don't have any insurance, you can go there. It's not gonna be free, but it will be sliding scale, maybe. It's very cheap, okay? So you can always go there. Every area has its community clinic, like Department of Mental Health clinic. So you just have to go on the DMH website and find out where you live. This is for the people who do not have insurance. And the ones who do have insurance, it's usually through their insurance plans, through their behavioral health part of the medical insurance. They can go on the website and find the closest specialist to the area where they live, right? Or call the plan. So help is there. Lots of people don't know. They think that if they don't have insurance, they can find help. This is not true, right? So they can find help. It's there. So just want to mention that.
Okay, that's great. And you said the Department of Mental Health, is that dmh.org or what is it?
LA County Department of Mental Health.
Okay, I'll find the link for that.
You can find the link. I just can't think.
That's okay.
But you can Google it easily, and you will see the clinics. The clinics are there. So we work by area, by different areas. So each and every area has its own local mental health clinic. Okay,
this is a little bit off topic, but do you have a take? Do you have an opinion on when you feel like the stay-at-home parameters are going to ease up?
I think they are already easing up a little bit, and I see it in first of all, I see it in people. So people start going out, they're getting out, and some of them they don't wear masks. And I personally think that you do not need to wear a mask when you're walking your dog, when you're just walking down the street. When you're out there, you don't need a mask, so it's okay. I also see it once a week. I still go to the clinic, and I'm there physically. So I see in my staff we're a little more relaxed. We're not that anxious at the first day. So it will in the next few weeks, I think we will see a little bit of a changes happening. I think it obviously will not go back to completely normal, and it will take months before we're there. And as you heard, it will come in stages. But me personally, I'm not going to bed thinking about COVID, and I'm not waking up thinking about COVID. Okay, I don't, and I encourage you to not do it as well. Yes, the disease is there; it's going to be around, as many other illnesses. Okay, so we can continuously live in fear, or we can just go on with our lives and try to do the best we can. And Jonathan, you are the best in telling us how to do the best we can, right? So doing all that, eating healthy.
Yeah, right. Control what you kind of manage what you can manage, right? Yeah.
is do that, you know, and you can still get sick, obviously, right? But I just don't think it's too productive to spend all this time in worrying what will happen. We don't know what will happen.
Right.
We don't know what will happen with economy. We don't know what will happen with the virus. We don't know what will happen with us in a minute, let alone in a month, right? So, you know, I choose to live my life.
Yeah,
And
so we're really in uncharted territory where we don't really have something that we can compare this experience with.
right,
So we really don't know where we're going. So manage what you can manage.
Yeah, wash your hands, you know, do all this personal hygiene that you should normally do anyway.
Yeah.
Okay, so I
Sleeping
cannot,
and again, exercising and eating healthy food and all that stuff that we've been told since we were in second grade, right?
you know, I mean, I don't want to say that if you have a real mental illness that
Yeah.
exercise will cure it,
Sure.
it will not. But I can tell you that my patients tell me it every single day that they struggle with not being able to go to a gym.
Yeah.
Because their anxieties are through the roof. And what the exercise does, it does take care of this part. If you suffer from anxiety, yes, exercising will reduce it. I can get you. Okay?
Yeah, and by no means, would I or anybody else ever say that that's a singular treatment for severe depression or anxiety or anything like that. But I have seen plenty of very credible, peer-reviewed papers on the extent to which regular physical activity helps to manage anxiety and with similar results to some of the pharmacological interventions.
Yeah, and it's not only based on paper reviews. I can see it. I see it in real life with patients. I do. So this is the most unfortunate thing that we cannot go to a gym. But again, you know, you made it happen. You made it possible for all of us to do it online. I mean, on YouTube and in live videos. And yeah, it requires a little bit more of a discipline to do it, but so does gym every single day. So, you know,
yeah, it probably wouldn't be any of our first choice, but it's a decent second choice.
It's a very decent second choice. I honestly hope we will have it even after COVID.
Yeah.
As opportunity for us who could make it, for example.
Well, we may. I mean, you know, listen, one of the conversations that I'm going to have coming soon will be kind of a roundtable discussion with some friends and colleagues that I have in the fitness industry who own their own fitness studios like Joe and I do. And we're going to kind of have a roundtable discussion on what is the future of fitness under the present circumstances. So we'll kind of explore those ideas, but I think there will be maybe kind of a combination of in-person and online kind of as a hybrid program.
I think it's amazing if you're gonna do that. I think it's amazing. I mean, I still want to come to a gym.
Yeah.
But like you said, you know, for someone who couldn't do it or who couldn't make it, it's always a nice.
It's a good second choice, right?
Second choice, yeah. So you know, I have to go because I do have patients waiting.
Yeah, I got one question for you. What's the first thing you're going to do when the conditions get eased?
You know, this question is being asked all over the places and all over the Facebook with my friends. So it's interesting. I don't have this question in my head because frankly, there is nothing that I cannot do now that I will be able to do afterwards. I mean, I guess haircut I can do now, but I mean, I'm not like dwelling on it. The other things I'm gonna start doing soon anyway.
You're gonna start doing soon anyway? Okay. Shh. Don't tell anybody. All right. Listen, thank you so much for spending time with me today.
I also want to mention that, you know, don't wait for clinics to open. If you need to get help now, lots of doctors, including myself, do telepsychiatry and telemedicine. So if you need, you know, help urgently, or, you know, sooner rather than later, you can still call the offices. You can still find help. So don't wait. Okay, we are there to serve, to help, and we're working.
So the big message here today is to get help if you need it, to pay attention to your loved ones and the people who are in your life, to see if there are any significant changes in behavior,
Please
to
do
talk
so.
to them, but to make sure that you seek help if needed. And if you don't have the financial resources, there are county resources that can help you.
I think that's the message. Yeah.
Karina,
I hope I said something that.
oh, you
know,
totally did, and I apologize for the technological issues. I'm gonna piece this all together in a nice video and put it back on our Facebook page. I thank you so much for spending the time. This is great, and I'm sure the community is going to get a lot of value out of it. But thank you again. I look forward to actually seeing you.
Thank you, and I hope it will happen soon.
Bye. So do I. Thank you so much. Have a great day.
Bye bye.